Introduction. Hello, everyone. I'm Dr. Emily Carter, a urology specialist from the United States. This year, I'm 45 years old, and I have spent more than 2 decades, specifically over 20 years, conducting in-depth research on the complex intersection between the urinary system, the nervous system, and sexual medicine. Throughout my medical journey, I have helped thousands of men better understand and take care of their bodies. However, there is one question that I receive very frequently in my clinic, but almost never see discussed openly, honestly, and scientifically in the media. That question is, what does masturbating every day really do to your prostate? Is this habit secretly beneficial, or is it actually damaging this walnut-sized organ? What specific changes are happening inside this crucial control station of the male body? The answer will truly surprise you, because the effects are not simply good or bad. They depend entirely on your age, your technique, and your overall approach to sexual health. The latest scientific studies have revealed fascinating biological changes that every man needs to understand in order to protect himself. Your prostate is never static. It is an organ that continuously changes and evolves. As you age, understanding how ejaculation frequency affects this transformation is the key to long-term health control. Before we dive deeper into these biological secrets, please like this video and subscribe to the channel so you don't miss any essential medical information for men. Today, as a medical expert, I will reveal the truth about what is really happening inside your prostate. Let's begin this journey of discovery right now. Part 2, the prostate, the second heart of men, ***. To understand why daily masturbation has such a powerful impact on the body, first, we need to decode the mystery of the organ I often call the second heart of men, the prostate gland. From an anatomical perspective, the prostate is a small gland only about the size of a walnut. It is located just below the bladder and in front of the rectum. This position is extremely strategic because it surrounds the urethra, the tube that carries both urine and semen out of the body. Many people mistakenly believe the prostate is just a passive organ, but in reality, it is a factory that produces a vital fluid. This fluid mixes with sperm to form semen, playing a key role in protecting sperm, helping them move efficiently, and providing essential nutrients for fertilization. During ejaculation, the muscles of the prostate contract powerfully to push semen into the urethra and out of the body. However, there is an important truth I want you to remember. Your prostate is never static. It undergoes continuous changes. As you age, over time, the prostate naturally enlarges. Medical statistics are truly striking. By age treads, about half of all men experience prostate enlargement, and by age fierce, this number rises to 90%. This enlargement not only causes urinary problems, but also leads to many other daily discomforts. Even more concerning is the risk of cancer. Aside from skin cancer, prostate cancer is the most common cancer. In men, research shows that on average, 1 out of every 8 men will be diagnosed with prostate cancer at some point in their lifetime. So when we discuss the impact of daily masturbation, we are not just talking about a personal habit. We are talking about direct changes to an organ that is already constantly transforming. Understanding its structure and how it functions is the first step in learning how to protect yourself from future health risks. So, what does frequent ejaculation actually do to interfere with this transformation? We will explore the surprising scientific benefits in the next section. Part 3, the surprising benefits of frequent ejaculation, a scientific perspective. Asterisk. Now, let's examine what medical research actually reveals about ejaculation frequency. You may find this hard to believe, but the changes happening inside your prostate when you do this daily are extremely positive. First, let's talk about the numbers. A groundbreaking study from Harvard University followed nearly 32,000 men over 18 years. The results showed that men who ejaculated more than 20 times per month reduced their risk of prostate cancer by about 20% compared to those who only did it 4 to 7 times per month. If you maintain a daily habit about 30 times per month, you are in the group with the highest level of protection. And it doesn't stop there. A study in Australia also found that men who ejaculated an average of 4.6 to 7 times per week reduced their risk of prostate cancer before age 70 by up to 30%. This is an extremely powerful protective effect. So, what is really happening? Biologically, I want you to imagine your prostate like a drainage system in your house. When fluid inside the prostate stagnates for too long, harmful substances and potential carcinogens can accumulate. Frequent ejaculation creates a flushing effect. It pushes out old fluids, preventing the buildup of toxins that can cause inflammation, cellular damage, and increased cancer risk. In other words, daily ejaculation keeps the biological flow moving, reducing the time harmful substances remain in contact with prostate tissue. I once treated a 62-year-old patient who lived in constant fear because his family had a history of prostate cancer. After we discussed these studies together, he committed to maintaining an ejaculation frequency of 5 to 7 times per week. 5 years later, his PSA levels, prostate-specific antigen, remain excellent, and clinical exams show no concerning changes. Creating this flushing effect is how you can actively protect your body from the development of cancer cells. However, the picture of prostate health still has other complex pieces, especially when we consider the factor of age. Why does this effect differ between a 20-year-old man and a 50-year-old gentleman? We will explore that right now in the next section. Barkat, the age factor. When is it golden and when should you be cautious? Asterisk, asterisk. As I shared in the previous section, the numbers showing the benefits of ejaculation are truly impressive. However, as a clinical physician, I must emphasize this. The impact of daily masturbation is not the same at every age. This is a crucial point that modern scientific literature has clarified, allowing us to personalize healthcare. First, let's talk about the golden period, men aged 50 and above. For this age group, maintaining a regular ejaculation frequency provides the strongest protective benefits. For the prostate, studies show that the risk of prostate cancer decreases significantly once men pass age 50 and maintain this healthy habit. In fact, protective benefits are recorded as strongest in the 40 to 49 age group and become even more pronounced in older groups. I remember one of my patients, a gentleman in his early 52s. He came to me, deeply worried, full of guilt, and asked, "Dr. Emily, is it too much to maintain this habit daily? At my age, could it be harmful?" After we reviewed age-specific studies together, he finally understood that at this stage of life, that frequency is actually a protective shield, not a threat. His anxiety disappeared, replaced by confidence that he was actively maintaining his prostate health. If you are over 50, research confirms you are doing something beneficial, not harmful. However, we must also discuss younger men, especially those in their 20s and 30s. At this stage, the medical picture becomes a bit more complex. Some studies suggest that very high masturbation frequency in young men may be associated with a slight increase in prostate cancer risk. Why this strange difference? Researchers hypothesize it relates to male hormone levels, specifically androgens. Young men with high androgen levels often have strong sexual desire, while high androgen levels drive libido. They may also stimulate the growth of hormone-sensitive cells in the prostate, especially in men who already have a genetic predisposition to the disease. So, my advice is this: age truly matters. While older men should fully utilize the flushing effect to protect themselves, younger men need more balance and should listen to their bodies. Understanding the relationship between hormones, age, and ejaculation frequency will help you gain the most accurate perspective on men's health. So, beyond the dry numbers, what is really changing physically inside your prostate? Each time you do this, we will explore these fascinating biological changes right now. In the next section, Part 5, dangerous mistakes you must avoid. Asterisk. We have discussed how daily ejaculation can protect your prostate. But as a doctor with over 20 years of experience, I must warn you, there are common mistakes that can turn this healthy habit into a harmful one. If you don't use the correct technique, you're not only missing out on medical benefits, you may also be silently damaging your body. Asterisk. Mistakes 1 and 2. Friction and pressure. Asterisk. The first and most common mistake is lack of lubrication. Doing this daily without lubricant causes friction damage to sensitive skin. Over time, this creates micro tears, leads to scarring, and significantly reduces sensitivity. I recommend always using water-based or silicone-based lubricants to protect tissue. Another mistake is using excessive force, known as the death grip. Many men try to compensate for reduced sensitivity by gripping harder, but this only damages tissue and creates a negative feedback loop. Use a gentler touch and vary your stimulation techniques. I once treated a patient with severe genital irritation due to this habit. Without lubrication, he believed roughness would make his skin tougher. In reality, he was causing progressive damage. After switching to gentler techniques and proper lubrication, his tissues fully recovered within 3 weeks. Asterisk. Mistakes 3 and 4. Rushing and porn. Asterisk. The third mistake is rushing. Doing it quickly, like a mechanical task, does not provide full prostate benefits. The arousal phase is when blood circulation increases and the prostate prepares for complete drainage. Don't skip this phase. Additionally, excessive reliance on pornography is a serious neurological issue. It disrupts the brain's dopamine system, making it harder to feel arousal in real relationships. It may also lead to compulsive behaviors you can't control. Asterisk. Mistake 5. Ignoring pain signals. Asterisk. Finally, never ignore pain. If you experience pain, burning urination, blood in urine, blood in semen manna, stop immediately and see a urologist. These may be signs of prostatitis, infection, conditions requiring urgent medical treatment. Daily masturbation is only beneficial when done consciously and with respect for your body. So, beyond physical effects, how does this habit affect your mind and stress levels? We will explore the connection between mental health and the prostate in the next section. 10%. The healthy practice framework. Asterisk. Mind-body connection. You need to understand this. The changes inside your prostate do not stop at the physical level. As a physician, deeply trained in neuroscience, I want to emphasize that mental health and prostate health are far more connected than you might think. When you ejaculate, your brain triggers the release of a chemical cocktail of neurotransmitters, including dopamine, the happiness hormone, oxytocin, endorphins. These chemicals not only help you relax and improve your mood, but also play a crucial role in suppressing cortisol, the stress hormone. As you know, chronic stress increases inflammation throughout the body, including the prostate. So, when you practice this habit correctly, you are indirectly protecting your prostate from stress-induced inflammation. Additionally, the relaxation response after orgasm helps improve sleep quality, supports tissue repair, and strengthens the immune system. Based on scientific research, I have developed a complete framework to optimize benefits, especially for men over 50 years old. 1. Frequency, once per day, is ideal for most men in this age group to ensure regular flushing of the prostate. If daily practice is not possible, 5 to 6 times per week still provides similar benefits. 2. Duration. Never rush. Spend at least 20 minutes from start to finish. A prolonged arousal phase optimizes blood flow to the pelvic area and prepares the prostate for complete fluid drainage. 3. Technique and mindfulness. This is what I always remind my patients. Be fully present in the experience. Focus on your body sensations instead of rushing to reach the finish line. Also, vary your stimulation techniques to keep your nervous system responsive and prevent desensitization. 4. Balance. Daily masturbation should be a supplement, never a replacement, for intimacy with your partner. If you start prioritizing this habit over real connection, that is a sign you need to rebalance your relationship. Final advice: listen to your body's signals. If you feel fatigued or uncomfortable, adjust your frequency. A proper routine should make you feel energized and confident about your health. So, when does this habit become concerning? And what are my final recommendations for you? We will conclude this journey in the next section. A percept, conclusion, and Dr. Emily's final advice. Asterisk. Gentlemen, together we have discovered a hopeful truth. Frequent ejaculation is not just a biological need. It is also a powerful medical tool to protect your second heart. For men, especially after age 50, this habit creates a flushing effect, pushing out harmful substances, reducing inflammation, and maintaining muscle tone in the prostate. Key numbers recap. The scientific evidence I shared is extremely convincing. Remember this number: at least 21 ejaculations per month can reduce your prostate cancer risk by 20%. In other studies, this protective effect reaches up to 36% when 7 in 1007 denal will face a prostate cancer diagnosis. In their lifetime, this truly becomes a shield you can actively control. Asterisk. Warning signs. Red lines. Asterisk. However, as a doctor, I must remind you about the red boundaries. Daily masturbation is healthy, but it becomes concerning in these situations. Behavioral, if it interferes with daily responsibilities, causing you to neglect work or social relationships, this may be a sign of compulsive sexual behavior and requires professional psychological support. Relationship, if this habit completely replaces intimacy with your partner, take time to reassess and rebuild real connection. Physical, never ignore the following symptoms: painful urination, blood in urine, blood in semen, persistent genital injury. This is when you must stop immediately and see a urologist right away. Final message: remember, your prostate is constantly changing over time. Maintaining a scientific ejaculation frequency is how you guide those changes in a positive direction. Don't forget to apply the framework I shared. Use lubrication. Spend 10-20 minutes. Practice mindfulness. Thank you for joining me, Dr. Emily Carter, in this in-depth series. If this information helped you, please like and share so other men can access accurate medical knowledge. Leave a comment if you have any questions. I wish you good health and confidence. Goodbye and take care.